is this one where you're lifting your arms behind you, is a pec stretch, but you're really only getting the top part of the pec. The part down here you'd have to do more like opening up that way as opposed to that way. So again, the pec, and I'm going to talk about both pec major and pec minor. So the pec attaches here, right, and it basically moves your arm bone in this way towards your body. So any of this kind of motion, and because you've got fibers going in all different directions, it's not just in, but it's in at different angles. So anything that you draw in, so if you're going to do like that sort of a thing, you're firing almost all pecs and nothing else. So pec major is the big one that we see on everybody's chest, and again, fibers in all sorts of different directions. Below that, you have 3 strands that attach to a bump right here called the coracoid process, which is actually the front of your shoulder blade. Let's see. Yeah, this would be my left shoulder blade. So, sorry, this way. Well, I'll have to draw it, you'll just have to get it. So the shoulder blade sits back there, but it's not just that. It's got a post that sticks out to the front of your body. The post comes over here and comes out right here. There's a bump called the coracoid process, and the clavicle or collarbone sits on top of that. Attached to the coracoid process of your shoulder blade are 3 strands of very taut little muscle that attach to ribs 3, 4, and 5. And those are called pectoralis major. So this is major, and then beneath that the 3 little ones minor. So major attaches to your arm and does movement of the humerus in the socket, right? Pec minor attaches to your shoulder blade, so it doesn't actually move the arm bone, it moves the shoulder blade forward like that. Basically, if you can imagine those fibers firing and contracting, shortening, they're going to do that. They're going to pull your shoulder blade up and around. Why am I talking about this? Because this is something that most of us suffer from and complain about. Oh, my shoulders, I can never get them down. I can never do anything. I must pull them back, right? Well, if we can learn to release the pec minor, that'll have the same effect.